All right.
Good afternoon, everyone. Welcome to the Jefferson County Health Department Board of Trustees meeting. It is also live broadcast on YouTube. You can go to the our webpage and onto the agenda to find the link there. I'm now going to call this meeting to order. Ms. Pinkley, roll call, please.
Mr. Peg,
I am here.
Mr. Deal,
Here.
Ms. Stidham. Here. Dr. Henry, Ms. Davis. Here.
And Mr. Deal, would you, excuse me, a quorum has been established. Mr. Deal, would you please be so kind as to read the mission, vision, and purpose?
Happy to do that. Jefferson County Health Department will champion positive health outcomes and behaviors through innovative programs and community engagement. That is our mission. The vision is advancing the health and safety of Jefferson County. And the purpose of the health center, as described in the revised Missouri ordinances, is Jefferson County Health Department is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Great, thank you very much. Next order of business is approval of the agenda, and I believe we have an amendment to that.
Mr. Chairman, could I suggest an amendment to move the first item under old business, Mr. Huber's presentation up to our next item.
Number 3 after guest, okay.
I make a motion to do that.
I'll second.
First and second, any discussion?
That's to help him get his discussion done so he can leave.
Yes.
Sure. Sounds good.
Any other discussion? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Now we need a motion to approve the amended agenda.
I move to approve the agenda as amended.
Second.
First and second, is there any discussion? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Next section is welcome a guest. I know two of the gentlemen very well, Mr. Oki and Mr. Ginicola. Welcome. Also here is Mr. Huber and Arch Images, and that'll be our next presentation. If you guys are ready, stand up and go ahead with your presentation. That's great.
Thank you. I'm Jim Huber with Arch Images Architects. Katie Kramer with Arch Images also. We've been working on your new building design. I think you all know that. I think I've met with several of you at different meetings. So it's nice to be here. Just a quick update on where we are. Drawings are finished, ready to go out to bid. So we're looking at getting confirmation on you guys are ready for us to go out. We're looking at that probably being about a 4-week bid time. Okay, once those drawings are issued. Once those bids come back in, we will open them all up, look at them and evaluate them. Give you our opinions on what they are and if they've met all the requirements of the drawings and the specifications. And we'll give you a determination on who we think that bidder should be and who should be the selected contractor on that. We're happy to come here and present those to you, however you would like to do that. We're happy to do that. So whatever you decide, you just let me know and we can continue on from there. Okay. We do have drawings of the building that we could show you and kind of just walk you through that quickly. We do have boards here of those two. I think you guys can keep those boards for your display here if you'd like. I think Tim, if I'm not mistaken, you were wanting to maybe do a town hall or
Yeah,
something
just
with
there's
that.
other interest in the community for us and we'll schedule, we'll figure that out. I don't know what date we're talking about, but I know we're in August, 8, 9, or 10, somewhere in that neighborhood. So
So
you guys can kind of have a discussion later. We'll talk about that a little bit. But if you want to go ahead with your
that
presentation.
sounds great. So just for you, we can have it that it's presented up on the screen here.
Yep.
We can have boards set around the room. We could have different people positioned different at different locations for the town hall. And we can just walk people through the plan and let them see what it looks like. So if you want to go to the site plan first, maybe.
Sure.
So if you're not familiar with the site, it's on Peachtree. Might have to expand that out just a little bit. Right at the top right there, there's an arc. That is the existing road at the top up there. Up the road. We're looking at extending that road down and then gaining our entrance into the site. We are coming down the site and into that parking lot. The grade, there's a little bit of grade difference there. Okay, instead of building a lot of retaining walls and spending a lot of money on the site, we thought it would be best to bring people down and then back into the parking lot. Parking in the front, you can see the building down on the bottom there, which is the L-shaped building. Off to the right-hand side, towards the bottom there, there is a little canopy that comes out for testing or if there's another pandemic, or if you want to do shots, or if you want to do car seat training or so forth. All of that can be done underneath that canopy. I'll show you where that is on the plan then when we get to the floor plan. Off to the bottom left there is a parking lot for your vehicles and your vans back there. You can see those three up against the building. And then we've got the trash enclosure and so forth back there. Those will be surrounded by a fence.
Is the van parking covered?
It is not. It is not. Okay, we go to the floor plan next. So, I know it's gonna be a little small for people to see. I can't hold up a board here if you'd like that. It's really up to however you want to
Well,
do
if you-
this.
Maybe we can ask, just zoom in on which particular point you want to talk to.
Okay,
So you got the three different colors, so.
so we've got the main entrance coming into the building. Okay, if you just want to start
The
there.
light blue,
We've got the the main entrance down here, but
the lighter blue.
she's getting there. The vestibule there is our entry point in with our lobby then right into there. So the main entrance into the building would be there. As you come straight in, there are three windows there for certificates. All the other items, water testing and so forth that you would do, that would be accommodated at those three windows there. To the left is the waiting room for the clinic. The idea is the flow is going to come in from that waiting room, down that door into the space. There are some huddle rooms and some consult rooms there in the front where you can take patients in, patients' families, and discuss whatever you might need to discuss with them that you would not have to go into an exam room for. As you go down the hallway there and make a left, there's the intake space with the height and weight. There's blood draw and a lab space there. There's a toilet with a pass-through specimen, a pass-through window for specimens to be passed through for testing. Down in that bottom lower section is the work area for those techs and so forth that are working within the lab space. And then above that is the lab that would be accessible to the outside, that covered area. In case there's ever a need and we have to gown up again or do any of that, that is a separated off area. We do have a plumbing rough-in in that work area that we could add a sink, so you could scrub in before you would go into that room. And you could gown out before you went into that room. If not, it is usable for anything that could happen underneath that canopy there. As you go up the page, there are our exam rooms. Page there, and then there's a prep area where they would prep the shots and medications that could be given at the site. That's directly attached to the nurse's station that's right there. Okay. For exams, and then as you go across the top of the page, there's some offices, biomed area, staff toilet room, but really there's the exit there for the patient to come out, and they can then go back up to the window to reschedule, pay for their visit. Or to do whatever else they might need to do there before they exit the building. Behind that office support area, there's a file room, there's some staff lounge back there, and then off to the right in that large colored area is the conference education space. It's a large space. It will be used for this section and for any other educational events you might want to have in the community. That can all be done within that room there.
Approximate size.
I believe it is, let's see, the total building is 20,000 square feet. I believe that room is about 1,100 maybe, somewhere in that range. So it's a
Compared to
pretty big room.
How large?
It's about 2.5 times this room here, roughly. The location, the other location where you have those two.
High Ridge.
High Ridge.
Yes.
It's a little bit larger than the High Ridge. Couple hundred square feet larger, just to give you a comparison. Off to the right hand side from that are our mechanical and electrical rooms for supply for the building. And then as you go down the page, we have their environmental and vector lab there, positioned adjacent to each other with a common work area in between. Thought process was to put sinks in the central area for cleanability and washing of equipment. And not just putting sinks all over and paying for that, but being cognizant of the fact that we could share that space in between the two. Vector has easy access out the door there to the side and then out there to get outside. There's a lot of testing and so forth that they do outside, and that gives them direct accessibility to that. The green area down below is all the office space. There's offices, a small staff break area, another conference room there. Administrative area, the billing and accounting offices. And there's a lot of huddle rooms that you're going to see. I think there's 6 or 7 of those huddle rooms, if I'm not mistaken. We have not accommodated everyone in this building that is also in one room. They can come and go. And those huddle spaces give them the ability to have a place to touch down and work. It also gives them a place that they can get onto a conference call. There will be monitors in those rooms that they can do some conferences electronically over the monitors. But it gives you a lot of flexibility then that people can come and go in this building and have a place to sit and a place to interact. Okay. Elevation wise, if you want to go to one of those perspective drawings, it kind of gives you, why don't you do that exterior view one, maybe? Kind of gives you an overall look of what the building would look like. There's our entrance in there underneath the signage. We've got the building off to each side. You can see the wings coming off, the canopy off to the side here, and then the parking in the front. We did need to talk a little bit about signage, but I've got 2 perspective drawings here, this one, and then if you can go to the next one, the exterior view. It just gives you another look as if you're coming up that drive or down to the building site. This signage is a little different than the other one. We just need to make sure of how you want to sign the building and where you want that to be. But that does give some pretty good visibility to signage. And you can pretty clearly see here the entrance to the building. Okay. We do have a short kind of walkthrough video. I don't know if you want to walk through that or not. You want me to go ahead and show that? I hope you don't get a little lost as you go through it. Trust me, we walked through the entire building. I will try to guide you as we go, and I might ask you to stop or pause for a minute just to read.
Do you want me to slow it?
You go right ahead and just run it as it is, and then if you could just stop it maybe when I say, and
Yes.
we can kind of reorient everyone as we go through this. But so you're going to walk right into the center, walk right into the building, into the vestibule, into the front entry. There are your windows that we talked about. To the left is the waiting room for the clinic space. We're going to walk into the clinic. Straight ahead of you are those huddle rooms and so forth. We're going to go to the right and then go into the blood draw area. There's 2 blood draw areas there and the lab space. So that here as we swing back into that work area in the corner. And then that's that lab area that has accessibility to the outside canopy space. Okay. And we're going to walk out of this Walk down the hallway and we're gonna briefly look into one of the exam rooms. You can see the casework, the exam table went pretty fast there. There's your IV prep and your nurse's station. Okay. We're gonna walk out of that space. And come back out into the waiting room. Why don't we just pause right here just a second, just to get everybody oriented. This is that exam, the clinic waiting room space, okay? Off to the left-hand side of those two windows, we do have a little wall separation there that comes out, just to get a little bit of privacy when you're at those windows. But, again, just to give you an orientation. We're now gonna walk, go ahead and continue. We're gonna walk back out into the main hallway. Then we're gonna make a left-hand turn and go into that front office area. Left. This is that front office area with the windows and the workstations that are set up there. And walk down that back hallway. Off to the left-hand side is our staff break room as we go through, and we're into the that main conference education room. See how big that is, blast to the outside. Back out into the hallway. Now we're gonna go through this door to the left. We're gonna walk into that office area. Why don't you just stop right there for just a second? This is that open office area. Those doors straight ahead of you there that look like they're sliding doors, those will be the huddle rooms. So those huddle rooms will have sliding doors on the front. You'll have furniture in there for 2, maybe 3 people. And then you'll have a monitor up on the wall that you can have for meetings. Okay. You'll see one here as we go past. And we'll walk down the hallway. And we'll look in the left here, we'll look into the conference room that's down there. And we're gonna walk into the office area here to the side. There's a conference room that separates the managers and the administrative area back here. Administrative office is there. Walk out into that open office area again. And then we'll walk into the vector and environmental lab. So this is our environmental lab. There's that interdisciplinary space, if you will, with the sinks. Then we'll walk down the hallway and back to the main lobby. It gives you just a feel of what the building looks like. Some of the colors might not be exact, some of the finishes might not be, but that gives you kind of an overall view of the building itself. Okay,
Is that all on one floor?
it's all on one floor.
Do we have a basement?
There's no basement.
Cost cutting measures.
Yeah.
It started as a 2-story building.
It did. It started as a 2-story building and we brought it down to 1. And then we tried to look and try to save the site costs also, trying to stay within our budget that we have. So that gives you a quick overall view of the building. All of those images that you see are all here on these boards. And again, we can produce some more if you like, and we have some additional ones if you want to put them up somewhere. But, I don't know if you have any questions for me or anything, anyone?
Is there any talk about a sign or signage on either B or 21, or is that a separate issue?
That'd be a separate issue.
It's a separate issue, but there is talk of a monument sign. If you go back to the site plan there, I'm sorry, that make you keep jumping around, you don't have the control. As you're entering into the building, as you're entering into the site, you're coming down that hill at that main drive there.
Yeah.
We talked about it, a monument sign up there,
Entrance.
so that you can see. Yeah, who was there.
So, is this 21 over here, like parallel to that road in front of the property? Is that 21 over here, and then this is the road? Is
So
this the gas station this way? or-
that is correct. The gas station is towards the top of the page where it says site plan is down towards the park. To the right-hand side, that new entry drive is at a dispensary building that's there. And then 21 is if you take that little arc at the top, one of them just come up here and point, it's just easier for me to. Up at the top of the page there, that street goes out and then it's 20.
Okay. That's B or B, whatever.
Well, it's where.
Peach.
Peachtree Drive is that, that's Peachtree Drive up there.
Beach further up by the gas station.
Yeah. Does that help?
I think that road comes between Dollar General and the Express Mart.
That's good. It's a quick overview. I really appreciate all the staff here and all the involvement that we've had. It's been very, very good. We've come a long way from where we kind of started, but I think we've gotten to a really nice space. So
I think a lot of people don't understand the time it takes and
it's a long time to get to the days, and yeah, it really does. So. Anyway, go ahead.
So
Yes.
when I went to view the property, it just seemed like it didn't have much, it has a lot of road frontage, but
Yes,
it just, and then what?
it does go down.
So
to
how
the
are you, I can't imagine you putting all that on one level and not have to,
So we, like I said, we are gonna come down that hill,
gonna come down the hill,
come down the hill and then build down below.
down there.
Yes.
So we have
In lieu of the two-story, when we priced up the two-story building, it was
out of this world.
probably twice your budget. And it just, with the retaining walls that we had to produce, because part of those walls on that building, you know, retaining wall. Then we also were retaining wall, we were also retaining a lot of soil on the site. It just got too expensive.
I was just curious how you're gonna do that.
So that's what we did. So that's why we went back to this decision, and I
Right,
think it's a
yeah,
good one. So you're
okay.
gonna kind of drive down
And then
to
are
it,
we excavating a whole lot of,
and then just excavating. We're not bringing any new soil onto the site. We're gonna, whatever we dig out, we're using elsewhere on the site. Where before, we were taking a lot of the soil off of the site, and we're not gonna do that.
Cool.
So, trying to use your money wisely.
Yeah.
Okay.
any other
Any
questions?
other
are we at
questions?
liberty to talk about pricing right now? Or
Well, we gotta
kind
go,
of looking
it's,
like, or
well, we're gonna go out, we gotta go out to bid, that's what we're doing now.
So what we'll be
We gotta
doing
put
is
the
we'll be
RFP
sending out an RFP. And that's a request for proposal is what that means. We'll be publishing that in local publications. And it's pretty much open bid. Whatever contractor would like to bid on the project, as long as they meet our requirements, they can bid on the project. We will collect those bids, like I said, we'll put that out probably next week. 4 weeks from then, we'll get the bids back. So it'll be at the end of August, somewhere in that time frame. At that point, we'll evaluate all the bids and determine who has met the requirements. And might not necessarily be the low bid. We all have to talk about that.
Yeah.
But who's the most qualified to do this work and who's got the most comprehensive bid? At that point, then you'll select whoever you want to, whoever that person is to do the project. We'll go in for permits. They can just get started right away. Just a lot of the long lead time items under contract, but they can start moving dirt, get going on the site.
We're looking at fall, then early fall, probably.
Probably for completion.
Well, just
Or
to get started.
Get started,
right?
yes, yes. It's probably a 10 months, 12 months time frame. I would think,
Depends what
somewhere in
you'll have.
somewhere in that frame, time frame. We're gonna be over winter. We hope to try to get
I
some
think it's
foundation
next fall for maybe potentially
Yeah.
opening the
for
building,
opening the building.
Okay.
Yeah,
you're away,
Yeah.
minimum.
that's
And
about
that
right.
depends on weather and hopefully no issues falling under.
That's right. That's exactly right.
The unknowns are never known when you start digging in dirt.
I know, that's the problem.
Been there before.
We've got our test borings done. We do test boring, so we kind of know where some of the rock is, but again, we're not test boring every inch.
There's probably a lot of rock.
We're-
there,
And
right?
we're not going as deep as we were either. so-
We're not going as deep as we were before, but we've tried to do our best with where we're gonna locate this building, get as many test bores as we could, so we can understand what's underneath that building. So,
About as frugal as we can make it.
okay,
Any other questions?
very nice.
I appreciate the time. Thank you so much.
Thank you.
And you get together with your person over there and figure out what date you like to do it.
Okay.
Let me know and get back to Steve and
We'll do it.
we'll make sure we get something. We're probably gonna go ahead and have it here
That sounds great.
just because of the cost structures of doing it someplace else, because
Yeah.
this is gonna be more of a walk in, walk out type thing, you know, not.
It'd be easier to look here, probably.
Did we want to do a formal presentation like this?
Probably not as formal. We maybe have that on the screen and just kind of answer the questions.
I think if
People
you
come
maybe
through.
want to,
put the
maybe you
boards
set up
up,
2 or
right.
3 zones of boards, and maybe we're on one side, maybe we have a couple people here, and then with you guys here, you guys understand the building, and you guys can help kind of walk people through it too.
That can't be the best.
Hour, 2 hour?
Oh, a couple hours at most. Depends if we don't have anybody showing up, I mean.
Yeah.
Most people are gonna show up.
Okay.
All right, thank you very much.
Thank you, everyone. Thank
Appreciate
you.
it very much.
Appreciate it.
I'm gonna leave at 5:30,
Okay,
but I can come back if I need to.
you are usually 5:30, so we're gonna move on. Our next section is approval of minutes and expenditures. So I'm looking at approval of the June 15th, 2023 town hall meeting minutes. Need a motion?
No motion.
Second,
I'll second.
any discussion on the minutes?
Mr. Chairman? I'm just noticing on the roll call on that meeting, two of us were not present, which would be Amber, Henry, and myself. On hers, it says excuse, on mine, it says absent. What's the difference? We would, what is the difference? Why would it say something different?
Mr. Chair.
I was gonna answer.
Okay.
As far as what I know, is Amber told us she wasn't gonna be there, and I don't recall you did. That's it. I mean, you didn't show up.
I let
You
you
didn't-
know.
No, ma'am, I don't remember seeing that. I did not see that, but if you would like to change that, we're more than happy to change.
Yeah.
It doesn't make a big
Yeah,
difference.
I appreciate it.
I will change, but I'm going to review. You said you let me know how, by email? That's the only way
We
you
had
had
some
to.
sort of a meeting
So
or
was
something
me-
we were at, I think about it.
I don't recall that, but it's not that big a deal. So we have a motion to change the minutes from, I presume that's what you're making, a motion, correct?
Right.
To change that minute from
I'm saying
absent
absent.
to excuse. Do I have a second?
Was that your fourth scan?
Yeah. Yeah. She's like, there's no way I could be in two places at one time.
Thought we couldn't change the minutes then. Yes, Christie.
Well, on that particular function, that's a side issue. It's not changing an actual vote or information. It's other than just from absence.
That's fine.
So do I have a second on that?
I'll second.
Any other discussion? Not hearing any, all in favor of changing absent to excused? Say aye.
Aye.
Any opposed? Motion carries.
Thank you.
Now we need a motion to approve the amended minutes. We did everything. Remember, so we need to redo that, please.
Then the town hall minutes,
Yes, sorry.
so moved.
Second,
Second.
any other discussion on the point? Okay, all in favor of approving the amended town hall meeting minutes, please say aye. Aye. Any opposed? Motion carries. Actually, you can't vote. You have to abstain. You have to abstain for you weren't there. Please mark down, Ms. Davis that was abstained because she was not there. Thank you. All right, I need a motion to approve the June 22nd, 2023 meeting minutes.
Motion to approve.
I'll second that.
Having first and second, is there any discussion? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Approval of the June 27, 2023 work session meeting minutes. First,
Yes.
a second.
Second.
Thank you. Is there any discussion on that? Not hearing any, all in favor, please say aye. Aye. We have one
I'll
abstention.
abstain.
Thank you. Any opposed? Okay, motion carries. Next on the agenda is the approval of the June 2023 expenditures for $79,917.69. Do I have a motion, please?
I move to approve the expenditure that listed.
Do I have a second?
A second.
Having a first and second, is there any discussion?
Mr. Chairman,
Yes, ma'am.
I want to call attention to excessive legal fees again. In close to $15,000-16,000. I think it's extremely high, uncalled for. I think that our attorney is being used quite a bit for things that, you know, our own staff should be taking care of and the chairman should be taking care of. So I just want to point that out. I think we have it in our packet, the actual billing, but I can't find it right now. What about that?
All that is in your packet, put online as well, so.
For a health department board meeting or person in charge of our legal affairs, it shouldn't be costing us 15,000 a month. So. I'm pointing that out on record and also. A member of the public reached out to me and they were wanting to know what the NACCHO, NACCHO, National Association. Whatever. What that means, and it was a summit, costed us $1,600, and what was that about? Well, I mean, why did it cost $1,600? Somebody went to
The seminar, I suppose.
a physically, one person to.
That was seminar. Yes, go ahead and answer that.
I was just waiting.
Thank you.
Okay, the National Association of City and County Health Organizations is the professional organization and for the national. There's the National Association for Public Health Agencies, in the United States. It is one of the premier conferences for not only policy administration development, but it's highly attended by health departments across the nation. We had two members that you're looking at, I believe, under that $1,600 one, that would include their stay, the registration, fees, the cost of that, and I will look to Kristen, was paid for out of a grant from our, it was paid out of a contract, or workforce contract, the ELC contract.
You
Which is-
attend that every year, or is it every other year? When, how often is that up?
We're paid the leadership after it, so
So it's a yearly,
the yearly expense
so it's been
for.
going on since, I thought it had been.
And I think another question was if they want to know who went to that meeting, who were the two?
I went,
Okay, yourself
and on that one, I believe
So-
it's.
I'm gonna ask you a question. What is the reasoning for the line of question?
this
Because
particular
these are
one came
normal,
from a person.
I know who it
that
came
reached out to
from.
me.
but it's a normal course of doing business, of people going to conferences, going to seminars. This is a normal course of business.
Question asked to me, so I'm asking.
The relevance is,
So the other person was our director and who else?
It specifically states on the register that was published in front of you, as well as in the online version, Jackson and myself. Jackson Hambrick, who is a staff member overseeing our opioid work from dashboard, and his was paid for out of his I also brand.
And that name was Jackson, is that correct, sir?
it's on
The
your
person.
list.
It's on the list, it's on the documentation.
Thank you, and then, I wanted to, I want to mention that this is going to be, in our expenses, if it's not already here this month, I don't see it here. But, Brittany Newell was hired as an investigator, to investigate in the case of my censure.
If it's not in there, you're not gonna talk about it.
So we'll be paying her bill,
Moving on.
because it was in the sunshine request.
I understand that. Moving on.
$14,000 worth of costs. Because they wanted to investigate me. So, okay, we'll move on, but that didn't need to be on record.
I'm not gonna put up with it. You know it wasn't supposed to be that way. You're not gonna talk about things that are not on the agenda. next. You have anything else?
Good.
Mr. Deal, you have something you want to say?
I'd just like, anyone listening to know, it's Ms. Davis's opinion that our attorney fees are excessive. I think the majority of the board don't agree with that. So I'd just like to state that.
Is there any other discussion on the actual bills? Not hearing any, all in favor, and this is approving the, go back to my agenda, approving the 2020 or the June 23 expenditure. So all in favor, please say aye. Aye. Any opposed? Motion, you're
On
opposed.
record as opposed.
Motion carries. Let's see, I need a motion to approve the June 23 electronic payments for $523,000 to $523,765,000.10.
So moved. To approve those electronic payments.
And first and second, is there any discussion? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries.
My
Need a,
vote was aye. Just, here's your number.
so was unanimous, all right, well, it was the four of us are here. Need a motion for the pre-approval of the August 2023 electronic payments for $600,710.52. That is for the August pre-approval.
So moved to pre-approve those estimate electronic payments.
Second.
And first, second, is there any discussion on the motion? Not hearing any, all in favor, please say aye. Aye.
Aye.
Any opposed? Motion carries. Next on the agenda is the director's report. Can we? Ms. Almer?
As you know, I included a written report in the board packet this month. I trust you had a chance to read it. Rather than go through every single item that's on it, I'd like to hit a couple of key pieces. And then just ask if there are any further questions. The first thing I would like to do is I would like to bring to the board a mission moment each month that will talk to you about the work that we do and the impact to the community. We've had our adult brain injury program volunteer as our first mission moment. They're funded through the Department of Health and Senior Services. They provide assistance in locating, coordinating, and purchasing rehabilitation and psychological services for individuals who have survived a traumatic brain injury. They provide two programs and two primary service areas. One is service coordination, one is rehabilitation services. And Brianne has a very short video that will talk to you, give you a mission moment from Sherry Lexa, who is one of our adult brain injury specialists.
My name is Sherry Lexa with the Adult Brain Injury Program. My area is Region G, which covers St. Louis City, County, and St. Charles County. Participants in the Adult Brain Injury Program have access to service coordination, which is help with locating resources in their area as well as advocacy. And they also can qualify for paid services, which is in place to help them ensure a successful independent life. I recently assisted one of my participants in regaining his independence. When I enrolled him last year, his main goal was to get rid of his court-appointed public guardian so he could get rid of his apartment and be able to move in with his girlfriend. Upon enrollment, we completed a neuropsych evaluation to kind of highlight the strengths and weaknesses he had and to outline areas that he could work on and improve in. Upon reviewing this neuropsych evaluation, the public administrator was okay with my participant getting rid of his apartment and moving in with his girlfriend. At the time, shortly after, he and his girlfriend got engaged, and he was very adamant that he'd be able to get married and move forward with his life as independently as he possibly could. So myself, along with Missouri Protection Advocacy, went forward with a plan to try to hook him up with providers to get supports in place so we could prove to a judge that my participant would be successful regardless of having a court-appointed guardian or not. So we worked with my participant and the provider to get supports in place. We have an in-home provider that comes out to his home weekly now and works on goal-oriented tasks, organization, planning, getting back out into the community and reintroducing himself to local spots that he used to like to enjoy prior to his brain injury. And then we also got him set up with an adjustment counselor to kind of get used to how life is going to be on his own now without having someone constantly dictating to him what he was going to do or needed to do or where he needed to be or the things that he needed to take part in. So with the supports in place that we had, we were able to go to the judge and the judge had no issue with relinquishing guardianship back to my participant. So I'm happy to say that he just finally was able to get married this past weekend to his fiance. It's been a year's work in progress, but it has been so rewarding. It's had its ups and downs. We've faced a lot of obstacles, lack of providers that just don't take the time to understand. But with my participant and Missouri Protection Advocacy, as well as myself, we went forward to these providers and laid out the situation, our goals, what we wanted for the participant, what his goals were and what he ultimately wanted. And we got there. It was a process, but we got there and he's so happy. I'm so happy. And situations like this, it's what makes it worth it. There's so few success stories in the world of brain injury. A lot of times people just get shoved away and forgotten, set up with supports and left alone to deal with it. But he wanted more and I wanted more, and together we got him there.
Want to say a special thank you to Sherry. She had courage to take the first mission moment for me. But if you'd like to learn more about that program, I have the information how to get to the state website that talks about it. We also do have information on our website for the adult brain injury program under our services. Other things that are included is just some updates regarding strategic planning goals, some of the internal challenges we're having with staffing, the external, looking at, we've got some new partners in the community, and so looking at starting to build those relationships and finding ways to enhance our service coordination with them. Looking at our accreditation, we received provisional accreditation from the Mitch Board on June 27th. We're submitting our final documents to them by the end of July. A couple of program audits that we're going to start highlighting from the different contracts that we have. Letting you know, public relations, some of the things that we're going out. So part of my position is going out and representing the health department in different forums and with different communities. So working with the department, or St. Louis Department of Health, that they're going through a behavioral health bureau launch, which is very similar to the work that we're starting to try to do with opioids in our dashboard. And looking at mutual support and regionalization of some of that data. The other items for information, just letting you know, there's a couple of committees that I have been assigned to on state level or with our university partners and local partners. We provided testimony for the opioid lawsuit in June. We've also, Jillian Bissell and Jacqueline Brown had also previously provided testimony on our behalf. And then just again, letting you all know that the Rotary clubs are going to be doing their benefit for our wellness program, our mobile wellness program on Friday, October 13th at Crystal Highlands. We're continuing to look for sponsors. So if we can work with you all to help build up some sponsors and bring in some teams to assist with that tournament, it would be greatly appreciated. Are there any additional questions?
What was that date? October?
It's October 13th. And it will be at Crystal Highlands Golf Club. You can just get with me. I can. On the minutes that are provided, there's the Jeffco Rotary webpage, which is jeffcorotary.org. And on that site, it's got all the information about the tournament as well as signups and additional information. Next up will be, oh, I'm so sorry.
Oh, no, you're good. I was like, as soon as I wrote it down, I was like, yeah, thank you.
Okay, and next, we have, most of the reports, our community services report and our clinical services report are contained within the packet this month. So we will move to the communications report with Brianne.
Step in real quick and just tell you that you have my congratulations and condolences on 2 elected positions you're now working with inside your peers group, so.
Thank you.
Very good report, Kelly.
I get to follow that up. Awesome. No. You guys are used to seeing my face up here. I'm gonna go through our Health Communications Board report. If you take a look at what you have in your packets, this month it's gonna look a little different than what my report has looked like previously. It was a lot of really fun charts and graphs and things that most people don't look at. And we've had a little bit of a structure change as far as the team within health comms, which is really awesome. So in addition to myself, we also now have our public communications team lead, 3 public communication specialists, and then our organizational development specialist is also within our new health comms team. So that's up in the very top of my blurb for the page that looks like this. Just to clarify, and it does say in here too, there were no new positions that were hired. It was rather some of our employees from our health education team moved under our communications because it makes more sense based on like our agency goals as far as increasing effective education out in the community, as well as promoting awareness of our agency programs and services. And then the organizational development specialist has moved under this team because of its focus on increasing internal communications, as well as workforce development and accreditation efforts. So I went ahead and highlighted some of the high points from our team. One of the things that I did want to pay attention or call your attention to was the Family Fun Day event that was in June, on June 8th, actually. It was at Salvation Army in Arnold. It was a really great event. I got to go twofold. I got to go as the photographer, but I also got to go as an aunt. So that was fun. I got to take my nieces around to all the fun things. So we had 285 community members that attended, and there were over 30 community partners. They all brought resources, education, and what I thought was really cool about this event was every community partner that came and had a table and had a space brought an activity. So it was really family friendly, and that's what I really liked. Some of them were like planting seeds. They could make like a little rain stick. There was called the stress ball one. That one was awesome. My nieces loved that. They put flour and a balloon, and then they get to, no matter how hard they squeeze it, they can't break it. Although my nieces could do it if they needed to. So it was just a really great partnership. There were lots of community partners, as well as a lot of our services and programs here from the health department were there, including our mobile wellness and our mobile dental. Some of the other pieces there is our community education. We presented vaping education to 46 high school students. There were 2 farmers markets that were attended with our smoothie bike. If you have not seen that in action, highly recommend you check it out. You get to ride a bike and make a smoothie. It's pretty legit. I mean, it's pretty good. Yeah, I know.
I was like, can we do that next meeting?
Well, I was. We can do.
I'm like, let's get the meeting, I'm down.
Tim-
Stressful.
Tim cried it the whole time, and it just makes me feel better. So welcome.
It's all movies.
So we also, of course, have some of our information there about bike helmets and car seats. In addition to some of the other programs that we did, some of our health ed folks went to that family fun event that I was talking about, and they created a bike rodeo, which was so fun. They had a little setup there to teach the kids like how to ride safely, how to fit their helmets. They got to bring bikes. We had some extra stuff for kiddos who didn't have anything. It was really great. So if you want to flip over to that next page, we have just a few more highlights. I know I'm moving kind of fast. Stress management program summary. This was kind of a summary that Adam Peters had put together. He's our team lead, and it just kind of talked about the different school staff stress management worksheet, or excuse me, not worksheets. There's the teacher in me. The workshops and stress kits for the schools that we passed out. So there were 8 workshops, and then that were provided to 5 different school districts. And then there were just some highlights of those workshops. So we surveyed folks before and after. 99.5% of participants said they can correctly identify their sources of stress. They can create an individualized action plan to reduce stress. And then part of that was also the stress kits. So one of those things that we provided were kits to individual districts that had fidgets. I believe we put some headphones in there so that kids could listen to some music to kind of help reduce stress. Just a bunch of different ways that the students and the staff can kind of have that access there. So that was a great one. Addressing homelessness, we continue to work on our Project Homeless Connect, which is the big event, but then also those quarterly events, which are the homeless and essential needs outreach events. We have one coming up August 2nd, 3rd, and that's always usually a big hit. We've got a lot of community partners as well. I believe I'm gonna have to double check on that location. I should have wrote that one down. Jillian's probably listening and she's like, you know this one. I don't, I'll get it, I promise. It's on our website. And then the last two things were more of our internal organizational development specialist, kind of her tasks. She worked on planning the last staff development day, and then as well as kind of updating all of our workforce certifications, just keeping us in line with our workforce dev plan and our accreditation efforts and all that. You'll also notice that on each of those, I address the foundational areas and the foundational capabilities that each one of the highlights that I'm bringing to you kind of hit. So it's in that real fun circle that we have with the colored pie pieces and then the blue chart. That's the foundational public health model, services model. So just kind of showing you how the things that we do tie to those state and national standards, so to speak. And then the rest of my report, I kind of thinned out the analytics for y'all because I know it was a little heavy. So social media analytics, the website analytics, and then our mobile app and our Google Business Profile ones. Do you have any questions in regards to my reports? Yes.
I think it'd be good for folks to be aware. I see there's a senior farmers market program where people can get, if they're eligible, $50 in benefits annually.
I totally forgot to mention that.
I was gonna say, that's important.
And how do people apply for that?
Let's see. So it looks like they would need an income verification and a residency verification. It looks like we're gonna fall in the St. Louis area. And that phone number is listed on there, 636-207-0847.
No, this is on the website, right?
This is all on the website, yes.
Thank you.
Yep.
And we'll pull it out, and do a separate post so that.
I was gonna say, I'll find something that they have posted and I'll either reshare or I'll toss something out there, for sure.
Thank you for mentioning that.
Okay, thanks.
Any other questions on my report?
And where was that? Where did it take place at?
Which one? The senior farmers market? Is that what you're asking about?
Yeah, the
Just the
senior
farmers
kids,
market.
with all the little things that they were able to do.
Oh, the Family Fun Day. So that was at the Salvation Army in Arnold. So the one off Telegraph, by the local house and the big car dealership. I can't remember the name of it. That one, because there's apparently 2 Salvation Army locations in Arnold. So, but yeah, it was a really great event. I mean, obviously I'm a little biased because I attended as an employee, but it was super fun as an aunt too. You got the wagon and the kids and loaded them up on snow cones, ice cream, lots of fun. Sitting back to your mom. So the only other thing here I have is we received an email in the communications inbox. So per our policy, I'm just going to go ahead and go through that very quickly. Yesterday, community member Liz Downer emailed her questions and comments for today's board meeting. Ms. Downer wrote the following, and I will fill in responses to her questions as appropriate. The movie The Sound of Freedom was released on July 3rd, 2023. This movie was done very well, highlighting the evil of human trafficking. How many board members have seen the movie? How many employees of the JCHD have seen the movie? So my response to that is, thank you for reaching out with this question. However, I do not have an answer regarding the number of employees or board members that have seen the movie. Although I can say as an avid movie watcher myself, I am now intrigued and will add this to my list of personal must watches. Ms. Downer continues in her email. Missouri is in the top 4 states list of most active in human trafficking. Jefferson County has a heavy human trafficking activity. Is there active training for signs of human trafficking and how to help when someone comes to the health department for help? Is there open communication with the JC Sheriff's Department on human trafficking in Jefferson County? Again, thank you for reaching out with this question. Part of our efforts to provide the best public health services include ongoing professional development. Our agency workforce development plan outlines certain trainings that all staff are required to complete annually, as well as additional required and recommended trainings based on the type of a position the employee holds. Per that workforce development plan, each JCHD employee participates in human trafficking training, which typically occurs at one of our quarterly professional development days. In addition to that employee training, all JCHD staff who work with Title X clients shall receive training upon hire and every year of their employment on the following topics: adolescence and mandatory reporting, child abuse identification and reporting, and human trafficking. Mandated reporters at JCHD include our physicians, nurse practitioners, nurses, and clinic personnel. Per Missouri law, the human trafficking hotline poster designed by the Department of Public Safety is required to be displayed in or near the entrance of family planning clinics, which both of our office locations are in compliance with. And then after working alongside our clinical staff for almost 7 years, I can confidently say that each of our clinicians are incredibly thoughtful about engaging clients, employing trauma-informed practices, and creating a space that is conducive for discussing sensitive topics such as human trafficking. Finally, Ms. Downer states, I understand that the lawyer present at the Jefferson County Health Department board meetings, Christy Coleman, represents the Jefferson County Health Department. Please state for the record the date the lawyer, Christy Coleman, was appointed the Jefferson County Health Board meetings recording secretary. Per the JCHD board bylaws, Ms. Jennifer Pinkley is the board corresponding secretary responsible for posting agendas, notices, and recording minutes of board meetings. Ms. Coleman is our attorney. She takes notes at our meeting as she sees fit. Ms. Coleman stepped in at the town hall as the secretary due to Ms. Pinkley's absence. Ms. Coleman also takes minutes during our closed session when Ms. Pinkley must leave. None of this is out of the ordinary. Those are all the questions that we have received. Anything else for me?
Thank you very much.
Thanks, guys. Thank you.
All right. Next course of business is to review sunshine rules and regulations. So everybody has a copy of the Jefferson County Health Center sunshine law reviewed. You wish to talk about this, Ms. Palmer? Is there anything you want to say about the sunshine before we?
The only thing, again, modeled after the state policy, the only thing that a recommended change would be underneath number 3 guidelines, letter A. It discusses the records being in the form of paper, microfilm, or electronic media. We don't use microfilm, and so just wondering if we could substitute the verbiage, and I apologize, computer went dark.
I believe, correct me, that this has been reviewed by our attorney at this time, correct?
Correct, it has been reviewed by the attorney, approved. So as far as the language, that records may be obtained in electronic or paper format, and if files are too large to email, then they will be placed on a JCHD jump drive for an additional charge. So basically just the cost of the jump drive to put it on there. But otherwise, it's as written. All agencies need to ensure they have an updated policy, so since it was on the agenda today, I wanted to just take a look at it, review it, and see if the board is okay with that change to it.
Any discussion points over this? We will bring this back next for approval on this.
Just that one change.
Just as well, if there's other changes that.
Oh,
that
and
you
this,
get,
okay.
what my suggestion would be is we can go ahead and discuss what we've got going on now and talk about it. But it's only about the policy that we're going to discuss inside here, and we can move forward from there. But if there's something we can talk about it right now, or we can all take our time, review this, make suggestions over the next couple of weeks back to Ms. Fulmer and Christie as well. I'll just put her on that email as well, okay? That way it can come to her and we'll iron it out then, and we can come back next month, and this will be put on the agenda. This was not on the agenda for a vote to approve this. So it was more of a discussion, review it, and this is what we're bringing out. So, I mean, I know there's a lot of things there for it, but this is to review the sunshine rules and regulations.
So just in summary, it just outlined what public records, where our public records as far as the health department, which we follow, the Attorney General's office. It goes into detail about what those closed records are. And gives the definitions, and then it talks about how we have a custodian of records and what happens internally when we receive it.
Good look over them, thank you.
Any discussion points about these sunshine rules and regulations? As laid out in front of you again, I'll review it. And come back over the next couple of weeks. If there's any tweaks, again, most of this is gonna be straightforward, most of it's gonna be pushed, you know, it is what the law is. Through the attorney, and really not much tweaking we can do to it. All right,
Mr. Chairman, in regards to the sunshine law that we're discussing right now. My attorney did a sunshine request.
order. You're not gonna discuss that situation. The email was clear to you,
How can I be out of order when I haven't?
because I know what you're gonna talk about, and because you emailed me about it. I'm
Okay,
not, you cannot discuss this.
well, I want something entered onto record. How can I do that?
What do you want entered
In this
into
meeting.
record in this meeting? That's not part of it. That's not what this is
I
about.
want something
This is
entered onto
that-
record. So how
Did
can I
you
do
make
that,
the
sir?
you did not make the sunshine request, your attorney did. I'm not gonna discuss this
On
any
my
further.
behalf.
Moving on. We can entertain topics for the next agenda. By trustees. Is there any topics that we wish to discuss for the next meeting? I know sunshine's gonna be on there as a vote for the policy. All right. No other topics to discuss?
Mr. Chairman,
Yes, ma'am.
the sunshine request that I made recently, and it cost $325. Was over half duplicates and blank papers. Couple of other books.
You're out of order. You're out of order. You're out of order.
And I
You're
just
out of
need
order.
that to be reviewed by
You're out
the
of order.
chairman
You're out of
Please.
order.
and.
Ms. Davis,
do
Ms.
that
Davis,
first.
Ms. Davis, you're gonna be out of order, and I'm gonna have you removed from the meeting if you're gonna continue. You were told in the email that your attorney who requested it needs to go back to our attorney and discuss resolution.
It's not
Did you-
anything to do with negotiation or resolution, sir. It's how our
your-
department produces a
It's
sunshine
your,
request.
it's your
They
opinion on that.
are adding too much fluff to it that's not being asked for and overcharging people. That's the problem.
When a sunshine request is made, it's fulfilled as it is requested. You were not saying that. You were telling us that you didn't get anything in the meeting. So
May-
again, it
may
needs
I-
to go.
May I have
between-
you
It
review this
needs,
just to
it
see what I'm
needs to
talking
go,
about?
it needs to go to your attorney, because your attorney is the one that requested the sunshine request. That needs to be resolved between our attorney and your attorney.
Yes,
All
Mr.
right. Not any other? Yes, ma'am.
There actually is already a procedure in place. If Ms. Mathis does not believe that we have complied with the sunshine law, there is already a procedure in place within the statute. Ms. Davis, and just so that you know, whenever Ms. Mathis asked us to produce those documents, we ran the searches according to the specifics that she requested and let her know that we are not responsible for ensuring that there are not duplicative emails because she asked for them from specific people. And then that all had to be reviewed for privilege, and which is why you see the redactions that you have as well.
Mr. Chairman, there's a copy of the
We are going to move on.
employee
to-
manual, et cetera, et
You've
cetera,
got-
but none of that was asked for. All of this stuff. That's not $325 for the sunshine.
Discussion The next discussion item is discussion on a new building town hall. Did you ever get anything from Jim, or we're gonna have to come with that date later?
He's gonna get back with me. He said
Okay.
he's leaving.
Okay, as soon as we
Looking
do,
around at the night.
we'll get that out on our website and send that out as necessary.
Probably.
That's the one I recommended, said he's gonna get back.
And
August, what month? August.
August, yeah, we're trying to get it as quickly as possible, so we can go ahead and.
So that people
move
can see
forward.
where we accept all the bids
Yeah,
now.
yeah.
Is there a particular time that?
I proposed to them that we do, I sent an email to 6 to 7:30 at this location.
I think that's good.
It'll be like an open house.
Yeah,
Town hall?
yeah, town,
Well, if more
we
of
will
us
be able to
like
answer the questions, but I don't know if it'll be as formal as the town hall. It'll be more just have the board set up and have the video that we saw, probably just rotating through, and we can ask questions. Or answer, we'll answer questions. I may ask some too, I don't know.
All right, so for everybody out, we'll make sure we post that on our website, so you can come here and actually get eyeballs on the actual prints that are laid out from Arch Images. Any other comments to that?
You and
Okay.
I will attend.
Oh,
Okay,
yeah, I
correct.
plan on being
Okay.
here. If, you know, we will have it as a meeting just in case there's a third person
That's better.
shows up, so that way we're covering ourselves of that. You know, we may not have to have a meeting if there's only two of us here. Next on the agenda is public comments. I don't believe we have any, do we? Public comments? Good, okay. We have no reason for a closed session, and the next thing we have is adjournment.
We have some minutes.
Well, we're gonna handle that when Mr. Combs back for closed session next time.
Okay.
All right. So I entertain a motion for an adjournment, please.
I'll second.
And we'll have the first,
I'll move.
first and second.
First
All right.
and second.
Any discussion on the adjournment?
Mr. Chairman, in order to be able to talk about something at the next meeting, we have to mention it now.
Yes.
Why not just in an email?
We're already
Before.
past that, but because I've explained this before, I'll explain it again. There are topics that you may wish to discuss, or Ms. Stidham wishes to, or Mr. Deal, or myself, or Ms. Henry, that wish to discuss, that we must give our staff time to do research on anything we're going to discuss. Because usually gonna bring that up, it's gonna require time for them to put things together to discuss it. That's why you do it this meeting
Gotcha.
to the next meeting. Okay. So,
So for the next meeting, can I say something now
do you-
that will get written down to do research on it so we can discuss it at the next meeting?
if you get somebody to second that, but we've already passed that point. So now you want me to go back under new business to entertain topics when we're to adjournment that you're asking now.
Yes, sir. Please.
My mother once told me no good deed goes unpunished. Ms. Davis, what would you like to discuss?
Okay, at the next meeting, I would like, because I keep hearing this.
What would you like to
over and over
discuss,
and
please?
Over from the public, that the way we produce our sunshine requests is very
Sunshine.
expensive and out of overpriced.
Okay, can we
And
stop you there for a second?
I would
Sunshine,
like-
the sunshine rules and regulations are gonna be on for discussion next time already.
I'm not wanting to discuss the rules and regulations. I'm wanting to discuss how we, as a department, are producing things for the public. We're supposed to be transparent, give them what they ask for in a very cost-effective way. And I would like to discuss that, and I've got a perfect example of it. And I'd like to see our department do better. Jeannie Goff's department, for example,
You know, you can use anybody you want.
I mean, you can call her the same day and she'll say, come on up. And she'll show you exactly what you need. You know, if you want a copy of it, great, 10 cents,
But
okay?
she's not gonna be producing, she's not gonna be producing 4,000 emails or going through something like that.
We didn't
She's
have
produ-
4,000 emails.
She's produced 300.
We didn't have 300.
She's producing. We hope, but they had to look through that many. So. Is there anything else you was, sorry, you want to discuss it? Is there anybody
I
wants,
just wanna
is there a
discuss
second,
our-
is there a second to that discussion?
That's part of the discussion about the
I'm
house.
sorry.
About the policies, about how we're
Alright.
producing them and
So-
what it's costing. Okay,
Is there a second to it?
Well, we're gonna discuss the.
We're already gonna discuss the policy. That's what I said.
we're gonna do better,
So,
right?
we're,
Can we do better? Be more transparent.
is there any really
We need to.
thing that you wish to discuss about going to an adjournment? Because you're tangent off to something else.
Nope.
We had to go
As long as-
backwards
as
for
long as we
you,
can-
which
we
I'm gonna
can go
explain to
into
you that this will be the last time I go back in the agenda for you. All right, I'm not doing this anymore. You've done it several times to me. We're not gonna go backwards anymore. Catch it when we go on, or we moving on. Do I have a motion? I have a first and second for adjournment. All in favor, please say aye. Aye.